Good morning, everyone, or afternoon, depending on where you are. Welcome to I think this is our third Road to Web Summit event, and this one is on preparing the perfect pitch. Thank you for joining us. My name is Wendy Hurlbert, and I'm the President and CEO of Life Sciences BC. As we begin, I would like to acknowledge that we are joining this webinar on the ancestral, traditional, and unceded territory of the Coast Salish peoples, including the territories of the Musqueam, Squamish, and Tsleil-Waututh First Nations, upon whose lands we are privileged to work, live, and play. A little bit about LSBC for those of you who are unfamiliar with us. We are a not-for-profit sector association where the life sciences ecosystem comes together. Our role is to serve as the collective voice for our 250 members and sponsors, made up of professional services, industry, academic institutions, and research institutions. We are privileged to do this work, and this is one of the many events that we're doing associated with Web Summit. Our mission is to advocate and catalyze growth of the life sciences sector in BC and beyond, and to allow the sector to propel forward through impactful networking, thought leadership, strategic programming, community building, and robust economic development and advocacy initiatives. Now, a little bit about Web Summit, which is now a month away, taking place in Vancouver from May 27th to 23rd. It's one of the most anticipated global technology conferences, bringing together industry leaders, startups, investors, innovators, policymakers, and more. Our event today is supported by Innovate BC through its Road to Web Summit Vancouver program, aimed at preparing BC's dynamic tech startups for the arrival of Web Summit Vancouver. Today, we're going to do the perfect pitch, where Anne Woods from RBCX will be taking us through her tips and things to avoid when you're actually preparing your pitch, both the deck and how to talk about your pitch. So a little bit of housekeeping before we get started. All attendees have their cameras and microphones turned off, which opens up the virtual stage to our lineup of speakers. If you have questions, and we hope that you will participate through questions, please submit them through the Q&A feature at the bottom of your screen. And this feature allows you to upvote questions. So if there are particular questions that you're interested in as well, please use that upvote button, and I will be monitoring that. And bring those questions up through the discussion. In addition, we are going to have an opportunity for people to win a ticket to Web Summit Vancouver. Actually didn't know that, which is why it looks like I paused. To enter, complete the Microsoft form, which will be linked to the chat shortly. 2 winners will be randomly selected later today, and our team will reach out to you to let you know that you are one of the lucky recipients of a Web Summit ticket. So now let's start the program. To start our session, I would like to invite Deputy Country Manager for Web Summit, Amanda Collett, to deliver some remarks about the upcoming conference. So over to you, Amanda.
Amazing. Thank you, Wendy. First of all, I'd like to thank Life Sciences for putting on this webinar and participating in the Road to Web Summit, along with Innovate BC, as well as it's obviously incredibly important for our BC economy to take advantage of the opportunities that Web Summit does bring to Vancouver. So some quick highlights to sort of touch on. How many attendees are we expecting? Over 15,000. That is across 130 countries. We have over 120 partners, as well as over 750 startups, over 600 investors. So this webinar is super valuable, especially knowing that there's such a large volume of investors, and that's on an international level. Giving you access to those investors you wouldn't typically be able to, or would be a lot more challenging. So the fact that they're coming to our doorstep is amazing on that aspect. Over 500 journalists, once again, international media, 350 speakers across 10 stages throughout the event as well. So the event itself takes place over 3 days, but we reference Tuesday, day 0. Internally, in other words, it's our opening night. We have our kickoff, and our first night summit kicks off as well, which will be happening downtown Vancouver. Our teams will sort of start to leak out the information attached to that So as always, if you've seen me before, I preach our app, that information will start to be pushed out. One thing I also want to highlight, which I'm sure Anne will probably touch into later on in this webinar, is making sure you are familiar with the app and familiarizing yourself with those investors. They will have a profile as far as what their portfolios look like. So whether they're generalized investor or specific to life sciences, for example. So just making sure you're using your time and your efforts wisely, because it can be overwhelming in the course of those 3 days because there's a lot of functions happening. So just wanted to
Amanda, if I can just jump in a bit, Anne's not going to specifically talk about how to connect with those investors. So maybe if you can put a link to the app or where
yeah,
they can find it into the chat, that would be really, really helpful. Because I think
yeah,
that's an important element of how do the company, we're more talking about how the companies prepare their perfect pitch, but putting that advice in of how companies can connect with those investors and set up meetings would be really helpful.
for sure. Apologies. What I meant was because she's preparing you for your pitch to prepare to send to those investors. I will be sure to do that right after this.
Thanks.
On that note as well, there is also, when you are on the app and looking to connect with those investors, they will be setting up pre-scheduled meetings at the actual conference, and you have to be invited to have that meeting in the investors lounge. So once again, really important. I will be sure to provide a link to register. You can find it on your iPhone, Android, and download the app as well. So on that, I am going to or would love to introduce Maggie Chan, who's the Director of Operations with Innovate BC. Take it from here.
Awesome. Thank you so much, Amanda. Thanks for that introduction. Good morning, everybody. And thank you so much to our partners at Life Sciences BC for this opportunity to talk with our BC innovators. So my name is Maggie, and I'm here on behalf of Innovate BC, a crown agency of the province of British Columbia, under the leadership of Ministry of Jobs, Economic Development and Innovation, or also lovingly known as JEDI. At Innovate BC, our mission is to foster innovation across British Columbia to drive long-term economic prosperity for our industries, our businesses, and our communities. We do this by delivering programs that that help BC companies grow locally and scale globally, with support in key areas like commercialization, intellectual property, mentorship, and capacity building. Whether it's through programs like the Integrated Marketplace or our new IP Hub, our goal is to help BC innovators thrive locally and compete globally. This is why we're so excited to be supporting the Web Summit this year. As Wendy and Amanda mentioned, Web Summit is one of the largest and most significant technology and innovation conferences in the world, bringing together over 600 investors, representatives from over 130 countries, and more than 500 media outlets. So we really feel like this is an incredible opportunity for our province's innovation ecosystem and startup community to showcase BC and what we have to offer on a global stage. Next slide. So to help BC companies make the most of this opportunity, we've designed the Road to Web Summit Vancouver initiative to prepare innovators for the global market that's coming to our doorstep. Through Road to Web Summit, we've partnered with over 15 organizations across the province, including Life Sciences BC, to offer programming, training, and events to help BC companies prepare for these global opportunities. In addition to today's session on crafting a strong pitch, there's many other ways to engage, whether it's building investor readiness, connecting with media, or accessing resources to support your growth. So you can learn more about this initiative and upcoming opportunities by visiting innovatebc.ca. We have a ton of events happening in the next week alone. So I really encourage you, and I'll share the link in the chat as well, to visit our website to access those opportunities. Next slide. And of course, BC will be right at the center of the action during Web Summit Vancouver with the BC Pavilion, which will be led by the Ministry of Jobs, Economic Development and Innovation. This is going to be a vibrant hub where companies, government, and ecosystem leaders come together to showcase innovation across 4 core themes: artificial intelligence, digital media and gaming, life sciences, and quantum technologies. So the pavilion will feature keynotes from leaders in life sciences, AI, and other key sectors, pitch competitions to showcase emerging talent, and panel discussions to explore BC's opportunities and challenges in tech innovation. Our key partners include Life Sciences BC, AIN BC, the Quantum Algorithms Institute, and the First Nations Technology Council, and many more. So we know this is going to be a great opportunity to meet some of BC's most promising innovators and see the ideas that are shaping our tech and business landscape firsthand. So in short, super excited to see what unfolds in the next couple of weeks ahead, and really looking forward to meeting some of you at Web Summit Vancouver. Thank you.
Thanks, Maggie. And Amanda, that was a great overview. So we're now going to move to bringing Anne Woods, who is the Managing Director of Life Sciences and Healthcare for RBCX, who's going to take us through the perfect pitch. Now, a little bit of background on this presentation and why we started doing this, and Anne reminded me of this earlier. We, as many probably know, have an annual conference called Invest in BC. And if you don't know about it, we will put it in the chat as well. It is coming up October 28th and 29th. And it involves pitching and partnering. So a little bit of a way to reconnect and continue those relationships with investors that attend both. And in 2019, before the pandemic, we found ourselves in a situation where we had a significant increase of investors that were coming into Vancouver to meet with our companies, and we offered pitch prep. And there was a noticeable difference between the companies that went through pitch prep and the ones that didn't. And following that, as many people know, we decided to make pitch prep mandatory so that people were prepared and could put their best foot forward while they were pitching. And the feedback from investors was extremely positive. Not only was the quality of the presentation very high, but also there was a consistent format that people used to present their companies. And that is something that investors routinely and continually tell us, that they like the format so that they know what they're anticipating and what they're going to see, and how the information that is being presented is being organized. So really watch for that as Anne is speaking. Now, we've big thanks to Anne, because she has been volunteering with LSBC for 5 years, putting on this pitch prep presentation, not only for Invest in BC, but also our investor readiness program. So with that, Anne, I will turn it over to you.
Thanks, Wendy. And maybe just quickly, since we've got the RBCX logo on this slide, for those of you that don't know what RBCX is, we are the innovation banking arm of RBC. So that's the largest bank in Canada. So it's a great mix of having a team that is dedicated to the innovation economy, but supported by the strength of a bank that's been around for over 150 years. You'll notice the title says Preparing the First Life Sciences Pitch. And one of the reasons I think why life science investors maybe weren't able to prepare the perfect pitch deck in the past is, if you go online and you look for preparing pitch decks for venture capital, you find a lot around companies that are in the tech space. And so I suspect there's lots of tech folks on the line today. And so this does sort of, you'll see that there's life science themes in here, but those definitely apply to tech as well. And so hopefully everybody will be able to get a lot out of this presentation. So the images, of course, because it's a presentation that we've done with Life Sciences BC are very life science focused, but I think you'll get the message, and you'll be able to use this regardless of the technology your company's working on. So the big piece that I always like to think about is, let's think about format before content. So this is really all about storytelling. So, what's the story that you're trying to tell with your deck, and also think about the audience that you're presenting to. So much like, if you're applying for a job, you want to have multiple resumes depending on the job that you're applying for. You really want to think about the audience. So you want to have more slides than you're actually going to be presenting. But really think about what problem you're trying to solve. How are you going to solve that problem? And if you're talking to really early stage investors versus venture capital, the way you describe that problem is going to be a little bit different. And so you may want to adjust the order. But if you can build a skeleton of your deck, that's going to help you think about the story that you're going to be telling to the audience. So think about things like branding and consistent formatting. Think about, the message that you're sending with your deck is really, will tell a lot about you, how organized you are, how well you're able to present your thoughts. Practice your presentation. So make sure you rehearse, do it in front of the mirror. I know it feels awkward, but I can guarantee you that it's going to make things that much better if you take the time to practice. So Wendy, maybe since you're my sidekick for this presentation, you've seen a lot of these now through both Invest in BC and of course all the different conferences that you have attended. So, what do you think are the biggest mistakes that you've seen in some of the presentations, or maybe something that kind of hooks you right from the beginning? So the kind of good and the bad.
Yeah, thanks, Anne. I was just reflecting on your comment about how you describe the problem, and maybe a little bit different depending on the stage of investor that you're at. And I think when we start going through the deck, we might want to unpack that depending on who you're talking to. I think the biggest thing I find, and it's probably very much for life sciences, is people end up speaking a lot about the science, especially when they're in the early stage. And of course, that's what you're looking for investment in, but you've got to help translate into what the impact of the science is. And I think that's where sometimes, I mean, I'm one that likes slides that are crisp and clean and not have too much information on them too. So, pictures of data are great, but if you start, with 8 bullets that explain the science, I think 2 things happen. One, you might lose people because the people that are attending the presentations are sometimes the more junior analysts that are doing the pre-work for the investors, depending again who you're with. But the other thing, it's really risky to have too many words on a slide, because some people actually start reading the slide as opposed to listening to what you're saying. So finding that balance, I think, is really important.
Yeah, that's a good segue into the next slide, which is exactly around that. What problem are you trying to solve? And so this is where, this is the hook. This is where you're going to grab the audience and engage them into listening. And if you don't engage them here, you'll see the phones will come out, or, if you're just talking to somebody in a one-on-one conversation, they'll get distracted. But you need to hook them, and that hook is going to be different again depending on that audience. So, if you think about maybe you're pitching to some angel investors that are passionate about the area that the technology you're building. So in the case of life sciences, if you're building technology, in it's neurology or epilepsy, and you're talking to a group that is passionate about neurology, you want to have if you have a personal story that you can tell, that's going to help with the hook. So if you're thinking about what gap are you filling, it is, maybe you're leaning a little bit more to the patient, and how you're making, whether it's, the patient's lives better, or you're making the healthcare provider or the caregivers' lives better. If you're, a little bit farther along and you're talking to venture capital firms, maybe the gap you're filling, you're starting to link a little bit more into, the current standard of care isn't meeting the needs, and that there is improvement that's going to drive cost savings. And so you do want to tinker with the unmet need and what problem you're trying to solve a little bit, depending on the audience. But thinking about the pain points that exist with current standard of care, thinking here about, like, here's what other people have tried and failed when they've tried to solve that same problem. And so really getting clear on the fact that there is a problem. Because sometimes what we see is people jump right into a solution,
Mhm.
and there really isn't that much of a problem. And that's the point where an investor says, you know, you're trying to solve a problem that doesn't need solving. It's sort of the if it ain't broke, don't fix it. So Wendy, any thoughts on like hooks that have really captured your attention? You could call
Yeah, I
out
mean,
some members that you know are great at this.
I think you,
Yeah.
I think you've really nailed it in the idea that this is actually the slide that you get to really tell the, you know, the headline of your story, you know, in the
Yeah.
sense of whether it's a personal story to your point, or talking about, you know, a number of people, an unmet need, a number of people that have this condition. There currently is no, you know, no standard of care. I think this is where in life sciences, there's a real, this opportunity of really being able to say, this is why, you know, this problem exists, and this is why this solution is important. I think that's one of, life sciences is a difficult industry. There's easier industries, I think, sometimes to work in, and typically people in this are passionate because they care. And this is the slide that gets to say, my discovery is going to help epilepsy or earlier diagnosis of something, if it's, you know, a diagnostic tool, or this is going to really disrupt, you know, you can potentially have a handheld ultrasound is going to allow you to triage, to be able to get seen quicker, to know whether you have to move remotely from a remote territory into a major health center. So there's a lot of, it doesn't have to be a long story, but it needs to be a story that most people can relate to. And I think this is also where even your layout here, like that visual, and then some words that allows you to complement it with the story so that they will listen to your compelling moment. The rest of it, as you're going to get into, is kind of more into the, okay, let me unpack how I'm solving this problem. That's not this slide. This slide is, I'm actually going to make something better for people.
Yeah, and it's your chance to show that you understand the patients, the caregivers, and the payers. Like, this is your chance to say, like, you know, I understand this problem, and that also will hook the investors to say, okay, they've done their market research and they get it.
Mm-hmm.
So I just wanted, before we go into the next slide, the Q&A is open already if people wanted to throw questions in there.
Yeah, I will.
Yeah, and so
up.
okay, you can monitor that, and then you'll
Yeah.
interrupt me if anything comes in.
Yeah, the current question I think is more for Web Summit, and maybe Maggie, you can take a look at the Q&A. I think that's really more for you.
Okay, we can do, well, can Maggie answer them online?
Yeah.
Yeah. Oh, perfect. Okay, so and then we've got some time at the end.
I'm just going to interrupt you on the pitch ones.
Perfect. Okay. So going back to that sort of flow and storytelling, we'll go to the next slide that talks about the science. And so really think about this as, you know, like, what's the solution and how are you going to solve this problem? And so again, this really goes back to, like, think about the audience. So you need to be prepared with deep science slides that really dive into the data for those people that do want to know. But at the same time, you also want to be thinking about, you know, how does the solution address the problem on a practical level? So there is a bit of a balancing act between sort of, you know, too little and too much. And that's where you can always have slides sitting in the appendix that if you do get a question, you can dive into that at the end and show that you've got that content prepared. But really, if you think about it, like, a novice that's listening should be able to understand the benefits of the solution that you're providing. So if you know, the average layperson can't understand it, you'll need to bring it up a high level. So I think Wendy and I, go ahead.
Can you talk a little bit about confidential versus non-confidential information here? Because that's always a big thing. I know when people apply to present at Invest in BC, we always make it very clear they need to send us non-confidential information.
Non-confidential. Yeah. So I think that's it absolutely you should be including non-confidential information, because one thing to remember is investors that have already invested in your competition are going to come and watch your presentation, because they want to understand, and your competition for that matter is going to be in the room, and they're going to be there. They want to know what you're developing. And so it's really important that in these types of sort of public setting meetings, that you're not diving too much into information that that is confidential, and that's just really protecting your company and protecting your intellectual property. You probably want to make sure that you do have some information on, where you're at on this sort of, this sort of IP kind of, have you filed? When have you filed? How much time is left? How much thought have you put into that? Did you work with really good quality IP lawyers? I definitely recommend, spend the money and show that you've been able to work with a really good quality IP firm, because you can make your company uninvestable if you haven't done that. So, think about what the progress is. I guess, yeah, we talked about thinking about the science, and Wendy, you touched on the risk of, you could provide too much and be giving away confidential information. So again, think about really your audience.
And I think this
So-
slide also is around demonstrating, how great your science is, and giving the confidence that to your point, that what the science is doing, and that the science is going to provide this solution or address this problem. And again, without getting into all the IP details, that you've actually, have the professional management behind it, that it's an investable solution or investable science.
And so, if you think back to that original slide where we talked about format and the order of the slides, you could sneak in just around this slide, who are your executive advisors your scientific advisors that you've worked with, what lab did the science come out of? You can decide where that kind of fits in the flow, but that can also, provide some credibility to the science. And if you can show it's like, it's been de-risked a little bit by the caliber of advisors that you've been able to recruit.
Mm-hmm.
And so the next slide talks about the market. And so this is, I have a few pet peeves when I see the market slides. So I think that it does show that people don't understand the market that they're entering into if they don't get this right. And so use market research, make sure that you really understand who the genuine size of the market that you're entering into. And so if you're working on an oncology product, don't just look at the overall oncology market. Like, really, let's be realistic and think about how we've developed TAM, SAM, SOM, and that might not be a familiar concept for everybody. So that's total addressable market, serviceable addressable market, and then I think serviceable obtainable market. So what am I actually going to go after? And one of the things that people often do here is they say, if I only get 2% of the market, this is a $2 billion opportunity, but they haven't told me why they're going to capture 2% of the market. It feels like they just randomly pull that 2%. And so I think a bottom-up approach to building what the size of your market is really important, and really understanding that your customer dynamics. So whether, like, who are the payers, what market are you launching into, what are the risks, what are the, how do people make pricing decisions, is the market growing, is it shrinking, what are the risks around the market? And there's no shortage of information out there. You can look at any sort of, if you can use the public market as a proxy and find out, what are investors thinking about that are the kind of threats to the growth of the market.
And a couple of questions about that. Often, people seem like, what's your perspective of global market, US market, Canada market? Because very often, and some of it is because of the accessibility of data, people immediately jump into US stats. But what's your sense of that? And
Yeah.
do you have one of those visceral moments, like your 2% of market reaction going on in your head when people start talking?
Well, I think, if understanding that when you're presenting to venture capital investors and you're trying to attract an investment from a venture capital investor, that you need to have $1 billion market. This is the type of growth you're looking at. So if you come with a really cool health tech solution that is, potentially going to be very disruptive, but it's disruptive for a problem that exists in the Canadian ecosystem, that's great, but you're probably not going to be able to raise money, and don't expect to raise money from an American venture investor, unless the market is going to be bigger than Canada. And so I think really, understanding that, like, what are the investors that are going to be giving me money? What do they need to see in terms of size of the market? So I think understanding, and there's some really good articles that we could maybe share after the presentation, that it's a really cool idea, but it's not a venture. It's not something venture capital is going to invest in. And so I think when people are thinking about the market, if you really want to scale, you've got to be looking to the US. And in the case, sadly, of when it comes to sort of health technology, medical devices, the adoption is more likely to happen in the US first. So it is important to be thinking about that market.
And
does that help?
there's a couple of questions that I'm going to come to, but just before I do that, I think it's interesting that you have reimbursement here, because reimbursement, as we know, is quite complicated and different in different jurisdictions, even different in different jurisdictions in Canada, depending on what your innovation is. So how important, when you're talking to a venture capital, is it important to understand the reimbursement model? Because I often see people stay away from that. And part of it is that, especially in biotech, like, it's a long way off typically when you're actually going to get the reimbursement. So it's more talking about market size and some of the other things. But I'm just interested is how much are we telling people that they really should understand reimbursement at this stage?
Yeah, so this is where I think that the life sciences community can learn a lot from the tech community, because at the end of the day, somebody has to pay for what you're developing. And I think if you go back, let's say 6 or 7 years, and if it was something like a if it was biotech, okay, well, you know what, I know it's a big market. I'm going to develop the science and I'm going to sell it to a bigger biotech or a big pharma, and then they're going to be the ones that have to worry about that. So I just need to be really, really clear on the science. And I think that was okay then. It's not so much now, for a couple of reasons. There are more biotechs that are taking things all the way through, and they're going to have to do that work themselves. And I think that the big pharma acquirers have learned, oh my goodness, we've acquired something that has great data from a regulatory perspective, but then we go talk to the payers, and the payers are like, okay, so great, it's safe and effective, but it's not that much more effective than something that I'm paying 3 cents a pill for. And so now I need you to go back and do more studies to show me why I should be paying the price that you're asking. And so I think more and more I'm hearing investors ask questions around who's going to pay for this. And you need to be building out your business model as if you're going to be the company that's commercializing this, because those are the types of questions you're going to be getting during diligence.
I think that is also very true on the med tech and health tech space. I certainly have a few scars of that from my past when we were developing digital tools that we were attaching to medical devices, and the medical device payers were appreciative of the innovation, but not prepared to pay for it.
Yeah.
So
And
really
of course, the
understanding
other,
that on the health tech side is it's not that it won't, I mean, for everybody that's listening to this, it's not that it won't get paid for, but you have to understand. I think I personally see it much more on sometimes the health tech side. Because I think the biotech side, I think it's a really good watch out that you just raised. But there's also the other path, which is licensing, which is often a place where the biotech innovation is heading to.
and the other thing we see is, budgets live in silos. And so,
Yeah.
Someone will come with a beautiful health economic study to say, if you implement this medical device in your hospital, it's going to save, this many dollars, but the medical device comes out of the CapEx and it's saving OpEx dollars, or the medical device gets paid for out of, one government budget and it's saving money in another government budget. And so it doesn't, that health economic study doesn't have the same impact because
It
people
has
are
the
thinking
impact
about
at the
those.
macro level, but not at the decision maker level.
Exactly. Yeah. That's a great
yeah.
way of describing it.
Yeah. So we have a question here at the start of the pitch. We say what our product service is, or is it better to wait until after explaining the problem?
So I would always start with the problem and then what the product and service is. And so that's, if you think about the product or service, is the how are you solving the problem? So first I have to believe that there's a problem that needs solving. So start there, and then you can build the story and tell the story that the technology that you're developing is going to solve that problem effectively.
Okay, great. And now
Okay.
I have another question here. For SOM, should this be the market size that we can capture in the very short term with our existing product and first pilot customers, the market size that we can realistically grow to via our roadmap in the midterm, assuming we get a boost from investment, or a projection for annual revenue 10 years from now when we established ourselves as a global market leader?
Yeah, so I would say option one is that near-term piece, and then as you develop the product and you've built your reputation with customers, you grow into the third description. So like that's the SAM piece. So the SOM is like, here's what I think we can get in the near term, and then here's what we can get if we continue to iterate and we raise more money.
Right.
That's the SAM.
Perfect. Okay.
So I'll move to the next slide, which is kind of building off of the market. If you think about it, it's really looking at competitors. So it hasn't flipped on my screen yet. Who are your competitors? There we go. Okay. So this again is it's like all of this is really about you showing investors that you understand the environment that you're operating in. So think about, who are your current competitors? So who are you disrupting? What competitors are in the pipeline? So who is maybe coming behind you that's doing something similar, sort of also trying to solve that problem, and really talk about why now is the time for the solution that you're developing. So thinking about the sort of the health economics, thinking about lower costs, thinking about improved workflow. So like, if it's a medical device, does it make the nurse's life easier? Does it make the patient's life easier, the caregiver's life easier? Does it improve outcomes? And it's like you can. Of course, you want to have like all green check marks for your solution, but maybe there's something that isn't a green check mark, but that's okay because everything else makes up for it. And don't just think about your direct competitors. So, you know, there's like a handful of stories of where, you know, you're so focused on your direct competitors that you're not thinking about what's happening that could be disruptive to the sort of industry as a whole. So the examples that I've heard lately are around the impact of the GLP-1s. And so let's say I'm a medical device innovator, and I've come up with a new gastric band for gastric bypass surgery. Well, is anybody getting gastric bypass surgery anymore, or is everybody just going on Ozempic? And so if I'm comparing my latest gastric band to all the other gastric bands that are out there, I might be the best, but it's a shrinking market. There was another example, we were talking about, it was a solution for cervical cancer, which is a declining market now that we know cervical cancer is caused by HPV, and you know, most teenage girls and boys are getting vaccinated for HPV. And so, you know, if you're thinking about if you're thinking the cervical cancer market is growing, like, is it really growing? Or, you know, how is that going to change? And so there's, you know, there's lots of stories out there about in the tech space. While Sony Music was busy fighting Napster in court, Apple Music was, you know, very quietly developing $1.99 a song app, right? That sort of completely changed the dynamic. And then, of course, with subscription services, that's changed things too. So really make sure that you actually understand your competitors and how you're better than them, but also, you know, who your competitors actually are.
Yeah, I think that's a really good point, because it also helps you demonstrate that you are in touch with what's going on in the market. You know, years ago, this would totally date me, but I used to work for a printer company, and our competitors were HP, Canon, you know, household names. And then all of a sudden, Xerox put their copiers on networks. And we had a new competitor that we used to monitor, Xerox, but that was the, you know, copy and then distribute, or email and print. Like, that was sort of, you know, it was just, where are you printing your stuff? Are you making a whole bunch of copies and sending them out, or are you emailing it to somebody and letting them print? And, you know, Xerox was a pretty formidable competitor that they and Rico and whomever else were just fighting over there, and we were just doing our happy thing. So
yeah,
I think your comment about disruption is really important. The other thing about disruptive technology is, in the health tech space, sometimes your disruptive technology is going to get paid for in a different place than the technology you're disrupting. And so what I've seen some innovators fall into a trap is that they're kind of going and knocking on the door of, you know, hospitals to buy their product, but in actual fact, their product is better serviced and positioned for community health centers, and hospitals don't buy products in community health centers. So I think that's the other thing about understanding, and that's more of an example from a disruptive space. The other comment I would make is, I always find this slide super powerful, especially if you're somebody that kind of thinks you know a little bit about what their solution is. And so it really helps you debunk all these things that are going on in people's minds, because it's a very simplistic way of saying, if it's something that the solution is something that people are relatively familiar with, doing that comparison and just getting the voices in somebody's head aligned on where your solution actually meets up with some of these competitors, I think is really powerful.
Yeah. And making sure that the features and benefits that you're listing are important. It's like, great, yours does that, nobody else does. Does anybody care?
Right.
So, you know, really, I think making sure that those are compelling.
So,
I'm going to go to the
we have
next
a question about reimbursement.
okay.
So we might need to
Okay.
have a separate session on reimbursement one day. Anyway, on the note of reimbursement, how can we link BC reimbursement with US market reimbursement Do we need to show a comparison, and where can we find the information?
You cannot link BC reimbursement to US reimbursement. Every payer is going to be different, and you're going to have to understand you're going to have to do the market research to understand how each payer thinks about that. And I would say, how do you find that information out? Like you're right, Wendy. Like, I think you have your next webinar ready after Web Summit's over. You can do something on reimbursement. Because there's, no shortage of people, information. There's IQVIA used to publish reports on reimbursement trends around the world. So yeah, I think ChatGPT could probably be very helpful in understanding reimbursement, but really it is a dog's breakfast, and it's why it's why pharma companies have so many people working in market access. So
I think the other thing about that question, and not knowing, there's obviously background behind it. I don't think anybody has an expectation when you're presenting that you are going to get that micro into province by province. I think you want to keep it at a bit of a higher level, unless it's something really disruptive that has a very unique path to reimbursement in a particular province. You really, if you're even going to go into the comparison, it's country by country, not province by province or state by state.
Yeah. So I'll go to the next slide. And this is a little bit, so, if you think about, like, there's a few different kinds of risks as you're building out your company. There's of course, the technology risk, the scientific risk, and the market risk that comes from competition. But there's also what I call execution risk. And so it's like, do you know what you're doing? Do you have a team that knows what you're doing? And mapping out, what you're trying to achieve and how much money you need to raise to get there is a way of showing investors that, that you've sort of mitigated that kind of execution risk, that you know what you're doing. And so showing them, this is the amount of money I think I'm going to need to get to a certain stage of clinical development, and making sure that that's a realistic amount of money. So Canadian companies have a tendency to try to do more with less. And they think if they go out to investors and say, I think I can do all of these things for only $5 million, the message that the investor actually gets is, you have no idea what you're doing. You don't know what this costs, and you're being totally unrealistic. So really, using a chart like this to talk about, what are the milestones that I need to achieve? How much money do I need to raise to get to that next value inflection point? And what else am I planning on doing? And so that can all be captured in a Gantt chart like this one. Anything, Wendy, like you've seen BC, have you seen it evolve maybe over the last few years?
I think one of the things, and it's partly due to the current economic climate today, is I saw a trend start about a year ago at the conference you and I will both be at next week, is that people were really leaning in on, this is my runway of cash, and using that as a way of saying, have confidence in me because I have a runway of 18 months, a year, whatever it happens to be. Because the reality is deals are taking longer. Due diligence is taking longer. In some cases, depending on what the technology or solution is, people are wanting to invest at a bit of a later state when it's, a bit more proven. So I've definitely seen that trend, and I expect to see that trend continue for the next at least 6 months to a year, that there ends up being this focus on how long is my runway, and what is my what is my cash runway realistically allowing me to accomplish.
Yeah. And so if you look at this chart, like what I've got, that clinical pathway blue line at the top, and it's sort of like, okay, here's where we're going to hit that value inflection point. The data is going to read out. I mean, these dates are old. It says 2022. And so like I've raised enough money to get to that value inflection point,
Exactly.
but you can see that the second green bar, it's like, you know what, you actually need to be raising more money before you hit that value inflection point, because you don't want to flip that card over. And now you've got, it's like, even if it's good, like, so if it's bad, you have no money. Like, what do you do now? Because it's like, okay, do I need to pivot? What decisions do I need to make? I got to have enough money left to like pay my people to keep them on up until I decide what I'm going to do. But if it's good, well, okay, great. Now I need more money. So now I've got to go out and raise more capital. And if you don't have anything in the bank to do that sort of, you know, like the additional clinical work that you need to do, you don't really have a ton of bargaining power with investors, even if you've got good data. So you really do want to make sure that you've kind of, when that card flip happens, that you've still got at least sort of 6 to 8 months of runway. So, you know, thinking about, you know, thinking long term, and yeah, you really do want to have that sort of, you know, 12 to 18 months of runway at any given time, just to give yourself that cushion.
And I think that answers one of these questions that was here, is there a number of months or years that hits a sweet spot where investors are comfortable with the amount of capital that you have?
So it depends on the environment. So I think, you know, when times are good, people are 12 months of runway. Yep, that's great. You'll be able to close something. When right now, I mean, I'm hearing anywhere from 24 to 36 months of runway. But in the case of like, you've got to be thinking about your milestones. So like, yes, you want 3 years of runway. But am I actually going to hit a milestone in those 3 years? Like, is something going to happen? Because it's like, if you have 12 months of runway, let's say, or 18 months of runway, but you're not going to get a card flip or some sort of value inflection point in that 18 months. You need more than
Right.
18 months.
Yeah. So there's
So
there's the linkage of the confidence of the runway time frame, which we're both saying, given this environment, people like more runway than less. But the other thing is getting you, hopefully that runway includes a milestone that, on the assumption it's successful, includes you starting work to the next milestone, as opposed to just only getting you to that milestone. There's another question about, there's lots of activities that should be on milestone or pipeline graphs that don't need to be. Are the ones in this chart examples of the most important ones to demonstrate?
I think so. Because like, these are the value inflection points, right? These are the things that are gonna lead to your company being worth more. And then I think that, you know, if you look at that manufacturing supply chain scalability piece, that's sort of, you know, one of the risk factors that people want to make sure that you've kind of done your work there. So let's say you've got a kind of difficult to make biomaterial, and you're out there looking for manufacturers, and you found somebody, but it's really small scale. And so like, they can work with you early on in your clinical trials, but if things are successful and it needs to be scaled up, you know, do you have a backup plan, or do you have an investor that can manufacture more of it? What are the, you know, of course, now more than ever, right, when we're talking about tariffs, like, what is your plan A and your plan B? And so those are things that investors are going to want to see that you've put some work into.
Right.
So I'll go to the next slide, which talks about business plan and financials. And so this is, I think you can, you know, like it again, like you're still telling your story, but you're getting a little bit in more, you know, more into the weeds. It's like, okay, so like, you've told me maybe on the Gantt chart, this is how much money I need. Like, let's get a little bit more specific. How are you going to spend that money? What's the use of proceeds? And same thing, you know, you want to tailor it to the audience. So, you know, how much do you need to drill down? You can have some, you know, more detailed slide, and some that it's a little bit less detailed. There are times here, and this is, I have an opinion on this. And so, you know, I would say we've all watched Dragon's Den, and we've heard somebody walk in. It's like, you know, we're asking for, you know, $100,000 for 10% of our company. So, which intuitively you're saying we think our company's worth $1 million. And then a debate sort of ensues. So, you know, your company's worth what an investor tells you it's worth. sort of like, it's just like your house is worth what the market tells you it's worth. And so I don't recommend putting in what you think your company's worth. Probably you think your company's worth more than an investor does. I think it really is important to just think this is how much money we need to raise, and this is what the use of proceeds, and this is what the value inflection point is. But I don't know, Wendy, if you've ever seen a presentation where someone puts this is what I think my company's worth, and you sort of think, well, wow, that's interesting.
Well, we've always advised, and yourself and a number of the other advisors on pitch prep over the years, and just for everybody's knowledge, when you do pitch prep with us, it's all done by volunteers that are dedicating their time, that are really trying to help people have be best set up when they're talking to investors. I don't know anybody that has advised putting the valuation of the company
in
on.
Yeah.
And that may be just a life sciences thing, because I think tech works a little bit differently sometimes, and depending on the rounds, but I always feel in presentations, you're trying to keep people captured. And as long, we've been talking about this for a while, but you've got 5 to 7 minutes to get through this deck, if you can get through it. So you don't want to put something on there that's going to distract people and have them stop listening to you. So if you go on there and say, well, my company's worth $10 million, and the investor's going, 10 million, not even a chance. I wouldn't even think it's worth 2. They're having a whole other narrative in their head while you're still talking.
Yeah.
So
Yeah. How did you come up with that? That's what I'm thinking. How did you come up with that? Yeah.
Yeah. And you don't, I mean, in our, in most of our, whether they're pitch competitions or presentations, we don't have a lot of live Q&A. We rely on people to do that after. But the last thing you want, if it's a live Q&A thing, is for some investor to say, how in the world did you come up with that number? Because then you're kind of done.
Yeah. 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 It's a great insight. The other thing I think that, and this changes over time. So, when times were good, the people were, and cash was flowing freely. One of the things people wanted to see in the business plan is like, oh, you've got multiple shots on goal. So it's like, if this doesn't work out, we can quickly pivot to this. Now that pendulum has swung all the way to the other side, where it's like, we need to see that you're focused. And so I think this is, an opportunity to, think about what the market is asking for right now. And if the market is saying we need to see that you're focused, make sure that you have, specific, like, okay, here's what we're not going to do. Here's what we are going to do. And so I think that, like, that's when you'll get asked these questions, is it's like, okay, we could take this in lots of different directions. We've decided to go in this direction because of X, Y, and Z. So focus right now is important.
That's great. I wanted to say one more thing about the valuation. I think it depends on what stage the company is at. Because if they've already had validated valuations, albeit the valuation now may be less than the last time, they may be in a better position to answer it. But most innovators think their companies are more valuable than investors do, as you've said. And so holding that for when you're having a one-on-one conversation is probably the better time to do it.
Yeah. Yeah. And, valuation is like it changes from year to year. The market dynamics change. And really, if your goal is, to bring a new technology to patients, thinking about, what is the most effective way to get there. And I don't ever want to find myself in a position where my company becomes unfinanceable because I've taken on too much debt, or I've taken on investors that don't understand my market, even though they gave me a really high valuation, or they gave me a high valuation. And now, so, we were saying this in the sort of the peak of the frothy life science market is like, okay, so you're getting lots of money and you're getting it at a very high valuation. That's exciting. What do you have to do now with that money?
Yeah.
Because, you want that valuation to grow. So it's like, if you're getting $100 million valuation, how are you going to get that to 200 million? Because that's what your investors are expecting, for that next round. And so, thinking about who you're taking your money from, and if there's someone that's giving you a much higher valuation than an investor that really knows your sector, ask yourself, what's the risk in that? And so I talked a little bit earlier about oh, go ahead.
I have another question.
Okay.
Is it important to highlight when subsequent rounds of funding will be required? So I think we talked about runway, but maybe not in 2 years I'll be fundraising, or 3 years. So maybe you can comment on that.
Yeah, I think so. I think, showing that you understand that, the total amount I'm going to need to raise over the next 5 years is X dollars. I'm going to raise, I need this much to get me to my first value inflection point. And then I need to raise, this much more to get me to my next value inflection point, which may be, and then you can start thinking about exit scenarios, but you should always be planning to take it all the way through. So really understanding what it costs to get your product all the way to market, and when those moments are that you're going to need to raise capital at are going to be important. So yeah.
Great. Somebody has asked the question that she gets asked frequently, which are, what are the details of the deal and how does she navigate that when she's responding to that?
Details of of a term sheet?
I think so.
Or
maybe the person that wrote that, you could add a bit more context to this question and we'll come back to it. So Anne,
perfect. Okay, so let's go to the next slide, because I think this is an important one, is, talking a little bit about the founder experience. In many cases with life science companies, the founder doesn't have any experience. They're the person that discovered, made the discovery. And so it's important to show that you're surrounded by business advisors and scientific advisors, and that you've partnered with the right organizations, that you're a member of Life Sciences BC. Of course, that's important. But also that you're, if you're working with the Mayo Clinic or the Cleveland Clinic, or you're working with some, large hospitals in the US, or some of the, public health agencies in Canada, all of those things are important. And really, in addition to the clinical development, de-risking your technology, this shows it sort of validates the science that you're working on. There are, of course, some people that we see a lot on some of these slides. So, think about, don't just put somebody on this slide that is on everybody else's slide. Really think about surrounding yourself with people that are actually going to engage and be, and be someone that you can call upon when you need them. In many cases, you'll see, there are leaders in the field, and if you're presenting to a VC, they know who the leaders in the field are. And so you don't necessarily need to provide a whole bunch of detail. You can just put the faces up there if they are the leaders in the field, and everyone's going to sort of nod knowingly. There's some debate, depending on who I talk to, about where this slide should sit in the presentation. So maybe if you're a more inexperienced founder, you want to throw this closer to the beginning, somewhere around that science slide, because it's going to help hook and give you a bit of credibility that you've surrounded yourself by people. There's others that want to, leave this at the end, because it's like, okay, all of this sounds great. And then you're kind of, putting this at the end to say, and look at, everybody that's been willing to engage with my company. So it really is about, validating and giving you a bit of credibility.
And I think it goes without saying, but you also need to get permission from these people to put their faces on these slides. So if you've had a casual conversation with the person that knows everything on this topic, and they aren't actually a scientific advisor, they shouldn't be on this. Because as much as it's great to credential really, some of this is, there's two things I always think this slide is doing. One of them is credentialing, because you've got these people that are some of them well known. And the other is being able to demonstrate the depth of knowledge that you have. Like, when you say the Mayo Clinic or whatever you're, UBC, BC Cancer, whatever you're saying, there's that credentialing, but then there's also that, connectivity of validation of the science. And so, to your point about there's a lot of pictures people use a lot, just really make sure that when those people are asked, oh, I see you're a scientific advisor to Wendy's health tech company, the person will say, oh, yes, and be enthusiastic and play the role that you're hoping they're going to play.
Yeah, that's such a good point. And the same is true of the organizational affiliations where it's like, let's say you're like, we're having conversations with J&J, GSK, and you're throwing company logos up there, like if you've sent them an email and they've replied to your email, that is not having a conversation. And so I think I don't think that J&J would appreciate that. And so you need to be thinking about going too far. It's a little bit the same as with the market slide. It's like, let's not exaggerate, let's be realistic and really use this to actually develop your credibility, because you can go a little bit too far.
Mm-hmm. Okay, we've got a bit more clarification on the earlier question, which is when I'm pitching virtually or in person, they will ask what my valuation is and how much I'm giving to receive X dollars. The individual seems to get asked this often, especially with angels and smaller investment firms, in order to avoid the how did you get to the number, in quotes. How do I pivot or answer this gracefully?
Yeah, that's like what I would do is I would, if it's a one-on-one conversation, you can do, of course, you can do some work on your own. And in fact, LSBC just did a really cool course on business development deals and valuations. And so there is lots of information out there on how to value your company. And, if you're thinking about sort of discounted cash flows and how big the market is, and, all of that work. And then there's comparables out there, right? So you can think about like, okay, if someone's working on a similar technology and that companies that were sold recently, like you can think about, where do I have to get my technology to be sold for that amount? And you kind of, move backwards from there. So you should have an idea of what the value of your company is. And so when you get into the conversation with the angel investors, you can one-on-one say, here's what the comparables are. But if you're in it, I would say if you're in a pitch competition and you're getting that question, I would say that you could sort of answer, it's like, I've done my comparisons. I know what the comparables are. I have an idea of what the value of my company is, but really, I think that's a conversation for me to sit down with an investor and have a one-on-one conversation, because I think the value of the company is going to be different depending on each investor. And so, I'd like to sit down with the lead and we can collectively together decide what the valuation of my company is before we move forward. Because, you're sitting in a pitch competition with a bunch of angels and like, that's the information they're probably not, they might not be someone you want to partner with. Like it should be someone that you can have a deeper conversation with.
Real life
Hopefully
is
that
not
helps.
then.
Yeah. Real life is not Dragon's Den. Yes. Very
Although
good.
for some, there certainly are some successful businesses that have started that way. But I also think for life sciences companies, it's a little bit different.
Yeah. Yeah. So I'm going to go to the next slide, which is a blank slate. Oh, did you have another question, Wendy?
Nope.
Oh, okay.
Nope.
So the executive summary sort of is a blank slate a little bit. A good rule of thumb is, okay, so now you've presented all of this information, just like we've just presented all of this information. And your audience is going to take away, maybe 3 things that are going to stick with them. So what are the 3 things that you really want them to remember? Capture that in the executive summary. I like the executive summary to be at the end because I think it's a really good way to kind of wrap up. Some people put it at the beginning. And they're like, if you remember nothing else from this presentation, remember this, this, and this. So, maybe you can put it at the beginning and the end, but I personally like it here. You can put your contact information on the executive summary page. This is your elevator pitch. So like, it could be something that you memorize in your head. So when you bump into somebody, it's like, these are the 3 things you need to know about my company. Let's book a meeting and let's talk. I also, when people ask me for, can you introduce me to investors? I need something like this. So I can quickly say to somebody, hey, do you want an introduction to this company? Like, I want 1 slide, not 25 slides. And so it's a really, really important slide. And just like every other slide, maybe you have more than 1 executive summary, depending on who the audience is. And it dawned on me that this actually would probably be, whatever content goes on this would be perfect to put in your company profile for any of these, whether it's an app or it's the one-on-one meeting portals that many conferences use. This is that great sort of like catchy 3 things you want to know about my company.
And are there, obviously it's different with every company, but are there sort of, if somebody came to you and said, I have these 8 things that I want to say, are there 3 that bubble to the top the most? In other words, I'm curing cancer, or my innovative something. Are there 3 that you would say, gosh, you need to make sure that's an executive summary?
Yeah, I mean, like, it's probably problem solution size of market, right?
There's a question, this is where you put your ask.
Definitely. You can, I mean, like, because the ask probably was in, like in that business plan slide. But you could absolutely put the ask in there.
Yeah, I mean, I've seen people and so I'm currently in a Series A of X amount of dollars or something like that.
Yeah. Yeah, that's exactly it.
As you've been, I was reflecting on, because you've been asking me about some things that I've seen. I think it's really important that you've got your RBCX logo up there on the top, and RBCX is a well-known brand. But I think it's really important that people remember to put their company name and their logo, if their logo is not including their name, on every one of these slides as a footer. Because sometimes, especially when you're in pitch competitions, after you've seen about 20, they sort of blur together a bit, as much as, people don't want to admit that. Or somebody might have walked in and missed your title slide, and then are interested and go, what's the name of this company? How do I find them on the app so I can connect with them? So just it's surprising how many people don't do that.
That is such a good point. Yeah, like it's like not only the walking in the middle of a presentation, but let's all be honest, right? Like your phone buzzed or your watch buzzed or something on the title slide. And so you missed the beginning. And so, what's this company called again?
Because they're super interesting and I want to learn more about them and, meet them in the partnering in the afternoon or whatever. And oh no, go ahead.
Question?
Sorry.
Okay. I'm going to go to this is the last slide, and this is all about the appendix. So really this is the, be armed with all of these things in case you get asked. So let's say you do your presentation. There isn't Q&As in the presentation, but someone pulls you aside and says, can you tell me about, some of the assumptions that you've made in building out your timelines? Can you tell me a little bit more about the clinical work that you've done? So you could have, 50 slides sitting in your appendix where you're able to pull those up. And I know when we're doing the pitch prep for Investor Day, someone will do their pitch for me and I'll be like, I'll ask them a question and they're like, oh, I have a slide on that, but I didn't think I should include that. And so we even tweak what slides they're actually going to include in their presentation. And it's really nice for them to be able to have those slides sitting in the appendix so they can just pull them in. So
Yeah.
this is really like, yeah, all the stuff that should be back there, and you can kind of go crazy on the details on those slides.
Yeah, that's great, because you can also, in follow-up conversations, obviously tailor it, move slides around. Somebody just in the spirit of my how to build your PowerPoint deck, somebody also suggested a QR code or website link, in those footers would be really helpful. So thanks for adding that.
That's a great idea. I'm going to add that to my notes for the next presentation. I love that.
There you go.
Yeah.
And somebody else is asking, which is probably a really good question, which we probably should have touched on earlier. If your startup is pre-revenue, what would be the best way to structure the financial slide?
So almost every life sciences company that we work with is pre-revenue.
I know, that's
that,
why I was like,
that doesn't mean that you don't have financial forecasts. So, if you think about that Gantt chart slide, I would say it's like, it's actually really easy because there is no revenue. You raise a bunch of money, you spend a bunch of money, but you've got to show me how you're spending that money. And so like, that's what's really important, is how much money do I need to do all the work that I need to do? And so there's, it's just not a P&L, it's just an L.
I think that's one of the uniquenesses of life sciences companies versus tech companies. I saw a chart recently that laid out what stage of fundraising you're at as a tech company, and it was very much linked to what the revenue stages were, and it was quite interesting, because of course in life sciences companies, health tech is a little different because it overlaps with technology depending, but if you're on your way to regulatory approval to be able to sell your product, you have no revenue until that moment, typically, unless you're in a licensing deal or something like that. And so our experience has been, and it's what you said, like very often there is no revenue. It's fundraising.
Yeah, the vast majority of life science companies will exit before they ever have $1 of revenue. That's the reality. And in fact, if you look at biotech companies, biopharma companies that are listed, that are publicly listed, so these are companies that have already technically had their exit, they've gone public. There's something like 450 that are publicly listed, 280 are still pre-commercial, clinical stage. So that is very, very, like, yeah, that's what investors expect to see, that you're pre-revenue. So yeah, you just need to make sure that you understand what it's going to cost to develop your technology to that next value inflection point. That's the key piece.
Well, and I think that's why this cash flow becomes so important. Right. The focus on cash flow and runway to milestones and beyond becomes so important.
So we've run over time. So I don't know if there's other questions for the group,
Nope.
but I don't want to keep hogging the time. I think we're meant to wrap up in 10
and
minutes.
I know,
Okay.
and you're actually in Montreal at meetings. So I want to thank you very much for doing this. We really appreciate it. If you need to drop off, please go ahead and I will close off the event. But big thank you very much. Virtual applause.
And
yes.
Thank you for being my
my
Ed McMahon. Thanks for being my Ed McMahon. See how if anybody gets that joke.
We'll go on a traveling roadshow someday. Okay, so thanks very much, Anne. A big round of applause for Anne, who shared some great insight with us. This has been recorded and it will be shared. So if you can get it through our newsletters or our website. I want to thank Maggie, who turned her camera back on. Maggie, thanks for still being with us. And Amanda for being a great partner in this event. Huge thanks to the LSBC team who have been very active on the chat and the Q&A throughout this to manage some of the questions. Now, this is your moment to make sure that you filled out the form for a chance to win tickets to Web Summit. So please, maybe Anisha, you can, the form is in the chat and maybe somebody will put it in closer to the bottom. And I just want to share some of the other events that are coming up related, at least the ones that we're doing related to Web Summit. So I think there's going to be a slide in a minute. We have our final of 4 Road to Web Summit events next week, which is Investor Readiness, and it's in person in Vancouver, put on by Brenda Irwin, who is another longtime volunteer supporter in our pitch prep and helping us select companies to go there. The chance to win just re-entered the chat. And in addition, while we have some other speaking series coming up, we want to draw attention to our annual award ceremony, which is October 2nd, and our Invest in BC conference, which is October 28th and 29th, where we have mornings of pitches and afternoons of partnering. So as we wrap up, I'd like to thank our annual supporters, which is going to come up. Without the support of these organizations, including RBCX, we would not be able to do all the work that we do to support the ecosystem and the community. So we really appreciate that. We are very much looking forward to seeing everybody at Web Summit. LSBC will be heavily populating and taking over the BC booth on the Thursday, which is going to be Life Sciences Day. The digital media and entertainment and gaming is day 1, and then deep tech AI is day 3. So there's a huge amount of activity happening at the booth, and as Amanda said, happening throughout the week. So this is year 1 of Web Summit, and it's just the beginning of what's going to be a really great focus on our tech and life sciences sectors for the next 3 years. So thanks, everybody. We will do a draw and get in touch with whomever was the lucky people to win the tickets to Web Summit. Thanks. Thanks, Anne. Safe travels.